Unnecessary surgeries, a disturbing trend in healthcare. Are some hospitals performing surgeries patients don't really need? A recent report by the Lown Institute suggests so, and it's a concerning revelation for patients and the healthcare industry alike. The report shines a light on 2 Pittsburgh-area hospitals and 1 near State College, accusing them of conducting needless back surgeries. The study, which analyzed Medicare claims from 2020 to 2023, found that Heritage Valley Sewickley had a startling 38% of spinal fusions deemed unnecessary, ranking it 4th in the nation for such procedures. Mount Nittany Medical Center, however, took the top spot for overusing spinal fusions with a staggering 57% overuse rate. But here's where it gets controversial. St. Clair Hospital in Mount Lebanon also comes under scrutiny. The report claims that 30% of vertebroplasties, a procedure to treat spinal compression fractures, were not required. And interestingly, St. Clair was the most likely hospital in the state to perform this particular surgery. Is this a case of medical malpractice or a difference in medical opinions? The Heritage Valley Sewickley Hospital's chief medical officer, Thomas Pangburn, argues that the report lacks clarity on the symptoms justifying spinal fusions. He also points out that most Medicare patients receiving the procedure are pre-approved by the federal program. The Lown Institute, however, maintains that these surgeries are often overused. They cite studies showing that vertebroplasties may not be much more effective than a placebo. Dr. Vikas Saini, president of the Lown Institute, believes this is part of a broader issue of wastefulness in American healthcare. But why are these surgeries still being performed? Saini suggests that individual doctors' preferences at smaller hospitals could be a factor, and at larger hospitals, it might be a reflection of the organizational culture. However, understanding the exact reasons remains a challenge. This report is the Lown Institute's 2nd annual publication on back surgeries, and it's not the first time these hospitals have been mentioned. While there's a slight improvement in the numbers for Heritage Valley Sewickley and Mount Nittany Medical Center, the lack of state-by-state data makes it difficult to track St. Clair's progress. As we delve into this complex issue, it's clear that the debate around unnecessary surgeries is far from over. What do you think? Are these surgeries truly needless, or is there more to the story? Share your thoughts and let's continue the conversation.